Hey, it's Rob Fitzgerald. Welcome back. Thanks for tuning back in. Quick session on white cell disorders. So I've got 5 slides. It's going to be a quick session. And clearly we're not doing the subject justice. We're just scratching the surface. And what we're trying to do is give you a platform to build on. So what I want you to know is, what are the classifications of the white cells and some of their basic properties. So white cells or leukocytes are classified in many different subcategories. One of those is lymphocytes, and the lymphocytes, you have B cells, and B cells produce antibodies, and you have T cells, so T helper, T cytotoxic. These form essential components of your immune system. We have granulocytes, and so that's broken into neutrophils, eosinophils, and basophils. The neutrophils are phagocytic, so if bacteria has been coated with antibodies, a neutrophil can eat it. They kill with lysosomes, so another important component of our immune system. Eosinophils, I think about in relationship to allergic responses. So your eosinophils go up in allergies. They have IgE receptors and also have granules that are part of the immune response. Basophils, they contain the vasoactive amines like histamine, so that's also part of our granulocytes. So neutrophils, eosinophils, and basophils are granulocytes. And lastly, we have monocytes or macrophages, which are phagocytic. They also are part of the presenting antigens to T cells. So, very complex system, but at least you understand when we talk about leukocytes, we're talking about the umbrella of white cells and then some of the differences of the subclassifications. So white cells typically go up in infection and inflammation. That makes sense. In leukemias, so leukemias are blood cancers. It's typically the blood-forming elements that have a cancer. You can have increases, which we call leukocytosis. You could have a normal, or you could have decreased values, which we would call leukopenia. So the key difference is in leukemia, you often have immature cells, so the precursors to some of the end products. It goes down in aplastic anemia. So aplastic anemia is really a decrease of all of the blood cells, so red cells and white cells. It could be due to primary bone failure, it could be due to an autoimmune process, or it could be drug-induced. There are also decrease in myelofibrosis, so that's essentially where your bone marrow is being replaced with fibrous tissue, so it's no longer functional. And if you have these, oftentimes patients don't recover from them. Hypoplastic, so white cells go down in some cases of hypoplastic anemia. Hypoplastic anemia is typically referring to decreases in red cells, but it also can be accompanied by decreases in white cells. If you have a B12 deficiency, you replace your B12, you can, patients recover from that. So neutrophils, typically with steroid administration, you're going to see an increase of neutrophils. They're also increase in inflammation. That makes sense. They're fighting bacteria. And in leukemia, again, as we pointed out, sometimes they go up, but particularly we're looking for immature neutrophils. In myelodysplasia and fibrosis, so that's what we talked about, where your bone marrow is being replaced by fibrosis, you would have a decrease in neutrophils. Lymphocytes go up in viral infections, and they decrease with steroids. So neutrophils go up with steroids, and lymphocytes typically go down. Neutropenia, lymphopenia, and thrombocytopenia, so decrease in neutrophils, decrease in lymphocytes, or decrease in platelets, can be drug-induced. Chemotherapy would be common, but it's not always chemotherapy, so cytotoxicity typically affects rapidly dividing cells, and your blood cells are subject to that. Also immune-mediated or idiosyncratic reactions, so basically you stop the drug and you hopefully, monitor the patients to see if they recover. And if so, then that might have been a drug-induced. Typically, if it's one cell line, that might be an idiosyncratic drug reaction, versus all of them being down is really, telling you something about the bone marrow and that you have bone marrow depression. So that's a quick introduction to white cells, and I appreciate you tuning in.